Now let's begin with these lines. वो खुद ही तय करते हैं मंजिल आसमानों की, वो खुद ही तय करते हैं मंजिल आसमानों की, परिंदों को नहीं दी जाती तालीम उड़ानों की, रखते हैं जो हौसला आसमां छूने का, रखते हैं जो हौसला आसमां को छूने का, उनको नहीं परवाह कभी गिर जाने की.
Ladies and gentlemen, as per the consensus report of rise in incidence of colorectal malignancies in the next few decades and the evident scarcity of dedicated colorectal surgery residency programs, there is a profound need for comprehensive training of colorectal surgeons in advanced technologies. Now, I would like to invite Dr. Rubab Nafis, Consultant General and Laparoscopic Surgeon. She has completed her MBBS in 2013 and has cleared FCPS in 2021. She has awarded Overseas Doctor Training Fellowship Program at Salford Royal NHS Foundation Trust. She is working as a consultant in Colorectal Disease Patient Welfare Association on honorary basis. She has a special interest in colorectal surgery and surgical oncology. Ma'am, kindly come on stage and please lead the session third of the day.
Thank you, Saja, for your kind words. Hi and good afternoon, everyone. We are going to start our third and last session of today. And every speaker will be given 10 minutes for this speech as we are short of time. And the question answer session will be held at the end of the session. I'm going to announce my panelist. Professor Qamar Baloch has is a professor of surgery, was a professor of surgery at Dow University of Health and Sciences. He has been worked as a chairman and dean of surgery and allied. And after his retirement, he joined as a medical director, Mehman Medical Institute, and now currently working at Al-Tibri Hospital. He has also been awarded as a member of faculty of surgery at CPSP and Society of American Gastroenterology and Endoscopic Surgeons. Professor Qamar Baloch. Our second panelist is Professor Asif Qureshi. Dr. Asif Qureshi is a professor of surgery at GMDC and is a consultant laparoscopic surgeon at Darussalam Hospital, Karachi. Our third panelist is Professor Farhan Zahir. Professor Farhan Zahir is a graduate of KMDC, is a fellow of CPSP since 2003, and is attached with Dow University of Health and Sciences since 2008. He is currently the current HOD of Colorectal Ward CHK Surgical Unit 5, and he has a special interest in laparoscopic surgery. Now I'm going to invite my speakers. Our first speaker of today's third session is Professor Abdul Razaque Shaik. Professor Abdul Razaque Shaik is a general surgeon, medical educationist, administrator, and researcher. He has worked for 25 years at Liaquat Medical University as a faculty of surgery and has been awarded as a best university teachers by HSC. He has been now working as a registrar at CPSP from June 2022. He has earned his MCPS in Health Professional Education and is currently attached with CPSP.
I'm grateful to the organizers for giving me the chance. Actually, the topic is not chosen by me, it's given by the organizers, just to talk about the upcoming fellowship in colorectal surgery by College of Physician Surgeons, Pakistan. This is the roadmap of CPSP that after MBBS, the house job, one has to pass the FCPS part 1, then register with registration and research CPSP, then year 1, year 2, then intermediate module, then year 3 and 4, and then the exam. Now this is about the first fellowship. And after this, the second fellowship starts. So we have got the two kinds of fellowship. One are the first primary fellowship, second fellowships. And as we have shown the chart below, that in 11 disciplines, there is a FCPS Part 1. We have got 80 specialties. Now it has come to be 81 really today. That we have got about 45 first primary fellowships, as you can see the long list, and then we have got the 35 second fellowships in FCPS. And MCPS, that membership we have got about 22, which includes the MCPS HP and healthcare management system. Definitely, I will not go to details of the rationale of the colorectal. That definitely this is very something very strong that every almost general surgeon is practicing colorectal surgery, and we have found that the colorectal disease are increasing, and especially the malignancies. We have to look for those malignancies definitely to diagnose early and treat early. So that's why it was decided by the faculty and proposed that one should come up with the training of the our trainees in the second fellowship. The aim is to residency program will be to train self and confident, competent colorectal surgeons, expert in their field. It is expected that colorectal surgeons produced by the residency program will be dedicated and empowered to contribute significantly. Now the duration of this second fellowship will be 2 years after this first fellowship. The eligibility criteria will be that must have passed FCPS general surgery and then registered with PMDC and in good standing with PMDC and CPSP both. Then these are the complete accreditation criteria. Should have at least one eligible colorectal supervisor as per criteria. Should have facilities. Now these are the criteria for the when we are going to recognize a unit for training of the colorectal surgery. Then these are the criteria. The people they ask what should be the criteria, that we should have at least one colorectal supervisor. There should be facilities in ICU, endoscopy and radiology, should have facility for oncology services, should be have designated beds for colorectal patients, should be designated OPD, should be have emergency facilities, and should have minimal invasive facilities. Now these are all criteria that any unit which have these criteria would be considered for recognition of training for second fellowship. The supervisor criteria, that 5-year post-fellowship in colorectal surgery experience, supervisor having colorectal fellowship or 15-year post-fellowship experience, or supervisor having FCPS, FRCS or Diplomate American Board or qualification and special interest in colorectal surgery, meeting minimum surgery workload criteria, completion of required CPSP supervisor workshops. We have got 4 supervisor workshops that he has to complete, and at least they have to submit the 50 MCQs also as per policy. At least 3 published research articles related to colorectal surgery in PMDC or CPSP recognized journals. Now this is the outline that we are undergoing the final touches, and hopefully that we are going to start in January 2023. Workload guidelines. What should be the workload? That should have at least performed 50 colorectal surgery procedures annually, the supervisor. The applicant has performed at least 150 colorectal surgery procedures as a primary surgeon. The applicant has performed at least 50 cases annually for at least 3 years at the time of submission of application. A single procedure can constitute a maximum of 10% towards the case count. Excess case may not be counted towards the total count. At least 5% of the procedure should be via laparoscopic surgery, that's minimal invasive surgery. The qualifying procedure, I will not go details of those procedures. There are common procedures like hemorrhoidectomy, internal sphincterotomy, rectal prolapse, neoplasms, and then stomas, diversions, and these are the common procedures being performed by the colorectal surgeon. At least they should give us the workload of these procedures they performed, and then we can certify according from the data from the operation theater, admission from the wards, and then we can say that they must be. Actually, the inspector who comes for this inspection is provided with a checklist. Actually, we have revised almost every checklist and every form for accreditation of the primary or second fellowships. And we have, according to the World Federation of Medical Education, we have revised those forms that have got the must, should, and should have. So the must criteria that I've shown you should have be very essential, otherwise the unit will not be recognized. Number of residents will be induction of 2 residents per supervisor at the time of induction, a total of 4 residents per year. Now we have got they can take the 2 trainees per induction for 6 months and 4 trainees per year. In general surgery, we have got 4+4 formula that if the whole unit is there, that is professor, associate professor, and assistant professor, they can take 4 for the primary fellowship and 4 for the going to other fellowships. But for the second fellowship, we have got the criteria different, that is they can take the 2 trainees per supervisor. So we have got very structured program, and we have got a chart made by the faculty, and they have to follow that chart, that 1 year, from first year they have to perform those procedures, second year, third year, and fourth year, and very structured program that has to be followed. And so definitely we are going for it is competency based again, technical skills, knowledge, research, communication skills, professionalism, teamwork. Again, I will mention that it's not time bound. Until and unless they have achieved the competencies, they cannot be passed. And one size doesn't fit all, as you know. One can have achieved those competencies 2 years, one can achieve in, say, 4 years. It depends upon the candidate, supervisor, and the training facilities. So definitely we are going for the technical skills, we are going for the non-technical skills and cognitive skills definitely, and then we can certify. The procedural, the milestones are that the observers, the trainee first observes, then assist, performed under supervision, and perform independently. Now, this is not the procedure that we advocate to be performed on patient. We say that they should have first training on some simulator, something like that, before they touch the patient. Otherwise, the patient's safety will be jeopardized. And definitely, this is the modern method of teaching rather than the 100-year-old Hallstadian method. And these are the competency charts that I told you that we have got structured. I'm sorry for this all busy slides. I've split it even in 2. So from first year, what the process they will perform from second year, third year, fourth year, and this is second part of that. And the supervisor has, these are given to every hospital which is recognized for training, and the supervisor must consider that these are done by the trainees, and they have to be record these all cases in their logbooks. And logbooks are to be seen by the CPSP, and then when they have completed their cases and educate cases, then we allow them to appear in exams. The rotations in second fellowship of colorectal are colorectal surgery 2 months, colorectal surgical 20 months, that is major, and minor gastroenterology for 2 months, radiology for 2 months, and special pelvic investigation for 2 months. That's optional. Sorry. So these will be things they will be doing in colonoscopy, anal, mandatory workshop, the research methodology, all workshops for supervisors, and definitely with that they must be very competent as FLS or that competencies for laparoscopic surgery that we have also started like ATLS. These are the research requirements, e-logs, and then syllabus. Exam format is a two-part. First MCQs and second is the 2 papers of MCQs, and then we have got the talks and long case and short case. All interactive sessions and talks. These are the long cases and these are the short cases. And this is the CPS. And thank you very much for your patience and listening. If there's any question.
Sir, being a faculty member of College of Physician and Surgeon, let me explain one thing. Sir has given the brief review. After getting the fellowship, they have, for the last 3-4 months back, they have started the fellowship in the hepatobiliary surgery. After that, I think one credit goes to the colorectal week and the COLOCON. They have made the, taste for the colorectal diseases and fellowship. So sir, वहाँ पर discussion in the faculty member हुई. So I have a little bit gave them a brief review that colorectal week and COLOCON ने जिस तरीके से colorectal surgery को enhance किया, and they made it. And second thing, when they have made the curriculum for the assessment के लिए, then I have already told them that we have the best global assessment tool in Pakistan in the shape of Professor Amjad, Professor Tehseen, Rao Saab is here, so they can assess the assessment of the colorectal exam very well, and I'm sure they won't mind that. So this is the brief thing which I have given to the College of Physician, and I believe because of these 2-3 persons, we will have a very, very strong colorectal fellowship.
That's true. First, it's recognized or formed by the faculty, then it's referred to the Department of Medical Education, and then complete our form, then it's referred to the registrar. From registrar, it goes to the curriculum committee,
Yes.
and from the curriculum committee, it's approved, it goes to the council, and then it's approved. So it's a
So
long
it is
way
in
to
the-
go.
it
It's
is in
not
the
a one-day
process.
job.
And maybe said CPSP will take some views from the Professor Amjad and Professor Tehseen and Rao Saab about the curriculum and the assessment tool.
One question from Professor Razaque Shaik Sahab. Can you hear me now? One question from Professor Razaque Sahab, that how many centers you have identified for colorectal surgery, and number 2, how many supervisor you came to know which are identified till today?
Actually, I have deleted these 2 slides about the supervisor and the hospitals, because I do not want to disclose all these. Definitely the persons who are performing daily colorectal surgery, they have been identified, and the centers, but I don't want to disclose at this time.
But without identification, where people they will go?
No,
Actually-
we will
actually what
definitely,
happened
the process is that
is-
after the announcement, we will recognize centers. It will be on CPSP website, and then we will recognize the centers and name those centers on the website.
Sir,
When they are yet to be recognized,
Sir, yeah.
and then it will start.
Sir, actually what
Like
happened,
in spine surgery and in liver transplant, it went like a wildfire. And within 2-3 weeks, everything, it went through the whole country. Okay. You are
sir,
right.
actually,
So, my question is, we do a lot of colorectal work, and that is almost all laparoscopic. This is the need of the day as well. So, एक humble सी बात है कि हम जो ज़्यादातर centers recognize हो रहे हैं, and again जो supervisors recognize हो रहे हैं, I think we need to train the trainers as well. Okay. So let's get out of. I know I'm too junior to talk about this, but unless we have a standard training program, तो वो चीज़ें जिस तरह चल रही हैं वो उस तरह ही चलती रहेंगी. So again, degrees मिल जाएंगी. जिस तरह breast surgery, I am sorry to say all this, but breast surgery के लोगों ने FCPS की training भी कर ली, सब कुछ कर लिया. They have never done a sentinel node. They have never done breast conservation. तो मेरे ख्याल के मुताबिक अगर इसको स्टैंडर्डाइज करना है तो we have to identify people who are already trained rather than identifying those people who are being made supervisor on the basis of their training experience and professorship. It's not going to work probably.
No, I must say that this list is not made by the registrar department. This list is recognized or approved by the faculty. And definitely while we are going for recognition, then I have taken this charge for the last 6 months. I have not recognized any center. To the best of my knowledge,
sir, I totally agree to whatever,
looking at district criteria. Okay, sir.
So I totally agree to whatever you are saying, but what the comment I am, as a humble junior, faculty member, what I am saying is that we have to, go beyond the traditional things.
Okay.
Otherwise, degree colorectal FCPS की सबको मिल जाएगी, और colorectal का काम आगे चलेगा नहीं. We have to identify people who are doing MIS colorectal. There are a lot of people who are doing it. There's not just a few people sitting around here.
Right.
बहुत सारे लोग कर रहे हैं, उनको आइडेंटिफाई करके सिस्टम को प्रॉपरली प्रोपोगेट करना पड़ेगा अगर हमने कोलोरेक्टल को आगे लेके चलना है.
We have actually identified the masters who are doing colorectal surgery performing throughout the country. And at least we have made it sure that should be public hospital because major volume is in public hospital.
Sir, actually we are running short of time.
Okay.
Sir, Professor Amjad, please.
देखिए मैं आवाज़ आ रही है जी.
जी सर.
एक जो इम्पोर्टेंट चीज़ है ना किसी भी प्रोग्राम को क्रेडिबल बनाने के लिए वो है ऑब्जेक्टिव असेसमेंट. ठीक है, मेरा प्रोग्राम मैं शोर मचाता रहूँ कि सबसे बेस्ट है क्योंकि मैं आपको बता रहा हूँ. अब कॉलेज या सोसाइटी अगर शोर मचाती रहे और कहे कि ये पीस ऑफ पेपर सबसे इम्पॉर्टेंट है, इट विल नॉट. तो ऑब्जेक्टिव असेसमेंट बिल्कुल इस तरह होगी कि जिसमें आप ट्रेनर्स को भी असेस करें और ट्रेनीज़ को भी असेस करें और उसको ट्रेनीज़ की जो फीडबैक है ना एट द एंड ऑफ द ईयर, जब ही एंड शी कम्स बैक टू यू इन 2 years और कहे कि जी मुझे आपने प्रोफेसर चीमा के पास भेजा, 6 केस करवाए हैं, बस ये है उनकी ट्रेनिंग. अब चूँकि प्रोफेसर चीमा का नाम बना हुआ है तो अगली दफ़ा ट्रेनिंग उधर भेजने की ज़रूरत नहीं है. यू शुड एम्पावर ट्रेनीज़ एंड टेल देम कि जी आप ये रिपोर्ट करें कि आपका क्वालिटी ऑफ ट्रेनिंग क्या है. तो जो ये ओन ने बात की है, आई कंकर विद दिस, ये ह्यूजली इंपॉर्टेंट है कॉलेज के लिए अगर उसने अपने आप को प्रोग्रेसिव करना है. मेरा कॉलेज से कोई ताल्लुक़ नहीं है, मैंने ना यहाँ काम किया है कभी, ना मेरे पास फेलोशिप है और ना मेरी कोई ऐसी इंटेंशन है. लेकिन जनरली मैंने ये देखा है कि वी आर स्टक विद ट्रेडिशन एंड वी आर स्टक विद नॉट मूविंग द गोल पोस्ट, क्योंकि हमें लगता है कि शायद गोल पोस्ट मूव करेंगे तो हम अपनी रेलेवेंस छोड़ देंगे. ठीक है, तो मेरी एडवाइस यही होगी, ये मॉडल नया नहीं है. आपने ये जो मतलब फॉर्मेट दिखाया है, ये मॉडल दुनिया में हर जगह अडॉप्ट हुआ है. मैंने आपको सर्बियन प्रोग्राम का स्नैपशॉट दिया था. उन्होंने क्या किया, उन्होंने एप्लीकेशन मांगी ओपन फोरम में उन सेंटर से कि जो समझते थे कि वो इस काबिल हैं कि उन्हें रिकग्नाइज सेंटर बनाया जाए. यूके ने यही किया. जब हम पोर्ट्समथ में लैपको का सेंटर बने तो देवर ओपन एप्लीकेशन, 55 सेंटर्स अक्रॉस इंग्लैंड अप्लाइड एंड दे सेलेक्टेड 11. वो इसलिए 11 नहीं किए कि ये माइक टॉमसन बहुत सीनियर सर्जन है, पिछले 20 सालों से काउंसिल का मेंबर है, मेरा दोस्त है, तो इसके सेंटर को ले लेते हैं. उन्होंने कहा बताओ डेटा दिखाओ. पब्लिश क्या किया है, 200 रिसेक्शन साल की करते हो, मतलब और एंडोस्कोपी है, लेप्रोस्कोपी है, कैसे ट्रेन करोगे. ठीक है, आई थिंक कॉलेज शुड पुट दिस आउट द ओपन डोमेन ताकि ट्रांसपेरेंसी हो. मेरे ख्याल, ये मेरी हम्बल ओपिनियन है. तो I'll finish off and then of course I'll welcome your comment. और दूसरा ये कीजिए, जो मैं अगर इन पता नहीं बच्चे तो सारे चले गए हैं खाना खा के, उनको पता है कि सारे हमें शोर शोरी मचाते रहते हैं बाबे बैठे. एम्पावर दैम, इनको बताएं कि जनवरी में आ रही है पोस्ट, उसके लिए ये जंप्स हैं जो हूप्स करनी है आपको कंपेटिटिवली उसमें सेलेक्ट होने के लिए. ठीक है, वो फिर ऐसा होता है कि वो मुझे पता ही नहीं चला, वो सिलेक्शन हो गई, वो मेरे रूममेट था वो हो गया, मुझे तो मैंने तो ऐड ही नहीं देखा. जब आप इस कल्चर से दूर होंगे ना, देन यू विल गेट क्वालिटी. मेरा अपना ख्याल है कि इट्स अ फैंटास्टिक अपॉर्चुनिटी कि आपने रिकग्नाइज़ किया है, कॉलेज ने इसको एज अ स्पेशलिटी. आप रिसोर्स डेवलप कीजिए, 6 सेंटर डेवलप कीजिए, 8 की चलें. शुरू में यही होगा ना, हिट एंड ट्रायल है. जब काम शुरू होता है ना तो हम सारे चाहते हैं कि हम इस पार्ट सक्सेस का बने, क्योंकि हमारा राइट है कि हम मतलब बहुत बड़े प्रोफेसर हैं, पिंडी में बैठे हुए हैं, हमारे अलावा कौन कर सकता है यहाँ काम. ठीक है, आपको मैं कहूँगा, आप मेरे डायरेक्ट जानने वाले नहीं हैं, मैं खुर्शीद साहब को कहूँगा कि वो आपके जानने वाले ज़रा बात कीजिए. ठीक है, तो आप साल के बाद आपके पास इतनी एम्पावरमेंट होनी चाहिए कि आप साल के बाद पिंडी में बैठे उन साहब को कहेंगे किबला आपने वो सब कुछ नहीं किया जो आप डिलीवर करना चाहते थे, दिस इज़ गोना मूव. तब आपका प्रोग्राम क्रेडिबल होगा. और इसके साथ आई गो अ स्टेप फर्दर एंड से कि ये 2 साल यहाँ लोगों ने लगाए हैं, उसमें कुछ लोग जो ब्रिलियंट होंगे उनको इंसेंटिवाइज करने का तरीका ये है कि यू गिव देम 3 months 6 months ओवरसीज अटैचमेंट यूजिंग द रिसोर्स ऑफ द कॉलेज, ताकि वो लोग उसको मतलब पैशन से करें। ये
मैं आपके कमेंट्स के जवाब में ये कहना चाहूँगा कि ट्रांसपेरेंट सिस्टम है हमारा। जब अप्रूव हो जाएगी ना फैकल्टी, इसको हम अपनी वेबसाइट पर रखेंगे CPS में। उसके बाद में एवरी हॉस्पिटल इंस्टीट्यूट इन द कंट्री हैज़ द इक्वल राइट टू अप्लाई एंड वी पुट ऑल द क्राइटेरिया ऑन वेबसाइट। दे फिल द फॉर्म, they send to us along with the fee, and then we see their form whether they have got all fulfilled all criteria. If they have the all criteria, they are ready, then we give them the inspection time. So this is our procedure. Second thing that you told that definitely the trainees are given the equal chances and the time. Definitely our induction will start for the whole month from 1st January to the 31st, 1st January to 31st January, and we can extend the time. Seeing that it is new faculty, recently we have launched spine surgery and liver transplant surgery, and there definitely
Sir, we are
there are a
running
lot
short
of
of
us for
time,
this.
kindly.
Sorry, I'm sorry, I'm not interested.
Please
But
invite
you
the
so
next
much.
speaker.
Yeah.
थैंक यू सो मच
Thank
प्रोफेसर
you,
अब्दुल
sir.
रज़ाक। आई एम ग्रेटफुल फॉर योर इंसाइटफुल टॉक। एक्चुअली ये बात कराने का मकसद यही था कि यहाँ पर कंसर्न लोग होंगे और इस बात को आगे करना चाहिए। एंड वी वर टॉकिंग, द पर्सन हु वाज टॉकिंग अबाउट दिस वाज द पर्सन हु हैज़ मेड द करिकुलम, सो ही नोज एवरी बिट ऑफ इट। ही कैन टॉक फॉर आवर्स एंड आवर्स टुगेदर, लेकिन क्योंकि हमें इस हॉल के टाइमिंग्स का भी ख्याल रखना है, तो आई एम रियली ग्रेटफुल फॉर योर कंट्रीब्यूशंस। प्लीज स्विच टू द नेक्स्ट स्पीकर।